My name is Kendra. I'm a registered nurse here at Renew Aesthetics, and we're going to talk about dermal fillers. So dermal fillers are an injectable that is made to add volume back to the areas that have typically lost volume. So as we age, our fat pads of our face, where they typically were when we were younger, they like to fall a little bit lower and we lose volume. The most common area would be upper cheek area. So places that we would normally have the higher cheekbone as we're younger tends to fall a little bit, and people start to get the jowling, nasolabial folds, corners of the mouth, that sort of thing. So those are the most common areas to treat. Typically the heavier type fillers we use for more of a structural support. So if you're trying to recreate the upper face, we would use, a thicker filler, a heavier filler in those areas. If we're wanting some filler that has a little bit more movement, we would stick with those on the mid-face or maybe around the mouth. So they're just different consistencies, and they last a little bit longer if they're a little bit heavier. With Renew, we like to stay with a very natural approach. We don't want your filler to show up before you do in a room. So when you see someone that has their lips done way too big or their cheeks way too full, you notice those people, and we don't want to have that connection. We want to consult with people and see what their concerns are, but not overtreat. And you can build on fillers over time. You don't have to have, a lot of work done at once, and you don't want people really to know that you've had a lot of work done typically. So we're here to work with the patients to look at their goals, look at the end game, look at the final result, but also slowly get them there and make it look natural. Next steps would just be call for a free consultation. We can sit down and talk with you over, 15, 20 minutes and get a good idea of what you're interested in, and get an aesthetics plan and go from there.